Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita, and I will be the guest today as well, and Ron will not be with us today.
And I'm Jean Marie.
Collectively, we're the crew of PodcastDX. I almost renamed us.
Okay.
On today's show, we're going to talk about heart arrhythmias and different options for treating them.
Could it be PodcastDX, and we'll talk about the Foz?
Oh, I was going to say the Fosbury flop.
We could talk about a lot of Fozes.
Okay.
I'd prefer not to talk about the Fosbury flop.
Yeah.
Arrhythmia, also known as irregular heartbeat, can be managed and treated through a combination of medical interventions and lifestyle adjustments, tailored to the specific type and severity of your particular condition. Any irregularities can be found through an electrocardiogram or ECG, also called an EKG, which is a quick test to check the heartbeat by recording electrical signals in the heart.
Yes, arrhythmias are irregular heart rhythms that can affect the atria, which are the upper chambers, or the ventricles, the lower chambers of the heart, causing slow, fast, or irregular heartbeats. The way they're categorized is based on the number of beats per minute, the time between the beats, and whether the irregularity starts in the upper chambers, or atria, of the heart, or the lower chambers, the ventricles of the heart.
As far as the number of beats, there are three distinctions. Bradycardia, which is a resting heart rate below 60 beats per minute. And while this is common in the young or the physically active, a doctor can determine if a slow heart rate is normal for you. Then there's tachycardia with a resting heart rate above 100 beats per minute, which may also include irregular beats. And lastly, there is premature beats, extra or early heartbeats, creating a pause followed by a stronger beat. And this is a common condition that can lead to other arrhythmias.
That's correct, Jean. And I guess I can cover the ventricular type, or the beats that start their irregularity in the bottom part of the heart.
Okay.
And the causes of that type of arrhythmias.
Okay.
There are two ventricular arrhythmias, starting in the ventricles or lower chambers. The first is ventricular tachycardia, which is a rapid, regular heartbeat in the ventricles, which may be harmless for brief episodes, but dangerous if prolonged, potentially leading to ventricular fibrillation.
Oh.
And you can probably guess the next one is ventricular fibrillation, or VFib.
Mm-hmm.
These are disorganized electrical signals that cause the ventricles to quiver, like
Right, rather than actually
beating.
compressing. Yeah.
Right.
Mm-hmm.
Stopping effective blood flow and leading to cardiac arrest if untreated. So of the two, VFib is the most concerning.
Mm-hmm.
Jean, can you go over the upper chamber problems?
Sure, I can do that. There are actually three supraventricular arrhythmias, starting with the atrial or upper chambers. The first one is atrial fibrillation. I think a lot of people have heard about that. And this is the most common arrhythmia, with over 2.5 million cases here just in the U.S. And it can cause the heart to beat more than 400 times a minute, impairing the coordination between the heart's chambers. And this is one of the arrhythmias you have at the moment, correct, Mother?
Yep.
Okay.
That's the one that's caused havoc this year.
Okay.
We could get into the specifics later, but we need to finish laying the groundwork.
Sure. Okay. So staying with the upper chamber, the others are atrial flutter, and as we talked about, a ventricular flutter, and SVTs, which is supraventricular.
No, not super.
Supraventricular tachycardia. And then there's also PSVTs, which is paroxysmal supraventricular tachycardia. And atrial flutter is when the upper chambers beat like 250 to 350 times a minute, often due to blocked signals from damaged tissue. And SVT is a generic catch-all term for a rapid rhythm that starts in the atria. And then paroxysmal supraventricular tachycardia, on the other hand, it's characterized by sudden episodes of extra heartbeats from faulty electrical signals and often occurs during exercise. And it's usually harmless and common in young people.
If the last two start in the atria, why is the word ventricle in the name?
Well, basically, it's due to the prefix supra, and that comes before ventricular. So supra means above. So they are irregular beats starting above the ventricles, which would be in the atria.
Okay.
And haven't you also had some of the QRS wide QRS readings? Why don't you include that in the way of arrhythmias and how they're classified?
Well, arrhythmias can be classified by either how fast the heart is beating, like the rate. You could have tachycardia fast or bradycardia slow.
Sure.
The regularity of the heartbeat, regular, irregular. I can't say
Irregularly?
Irregularly regular,
Right.
irregularly regular,
And then
who?
irregularly
Irregular.
irregular. Yeah, no, that's
That's a mouthful.
it is.
And finally, by the width of the QRS complex, narrow or wide.
Okay. Yeah, I had like one class on reading EKGs, and I remember nothing.
Okay.
Can you explain that in maybe some layman's terms, please?
Sure. So your heart has a built-in electrical system run by nerves
Okay.
that tells it when to pump blood.
Okay.
This happens in a specific order. First, the top chambers, the atria, pump blood into the lower chambers, the ventricles. Then the ventricles pump blood to your body and lungs. The wide QRS is a lower chamber issue.
Okay. So you have issues with both chambers,
I-
with all your chambers.
I guess so.
Okay.
And because we talked about the EKG before, I don't know if everybody has seen an EKG, but the graphing from an EKG machine has a series of spikes each time an electrical impulse makes the heart react. The QRS part of the EKG represents the moment when the ventricles get the signal to pump and actually contract or squeeze. So that's when that's the QRS part.
Okay.
It's the largest spike on the EKG because the ventricles are stronger than the atria.
Okay.
Doctors check the size, the shape, and the timing of that spike to see if the electrical signals are traveling properly through the heart.
Okay.
A normal QRS means that the ventricles are doing their job correctly. A wide or abnormal QRS can mean that there's a delay or a problem in how the signal is moving, which could affect how the heart pumps the blood.
Okay.
It means that the electrical signal is taking longer than normal to pass through the ventricles. It's like a traffic jam, slowing everything down.
Okay.
So wide QRS, or it's also called wide tachycardia complex, happens when the ventricles are beating too fast and the electrical signals are moving through them abnormally, and this can happen for several reasons. There could be a problem directly in the ventricles, or there could be a signal starting in the wrong place or traveling an unusual path. A heart beating too fast doesn't pump blood effectively, which can make you feel dizzy, lightheaded, or even cause you to faint. In some cases, WTC, or wide tachycardia complex, can be dangerous if not treated quickly, especially if it's caused by a serious heart condition.
Okay.
Doctors use tests like the EKG to find out why it's happening, and they may treat it with medications or electrical therapy, like a shock to reset the heartbeat, or other procedures to fix the problem.
Okay. So now that we are on to treatment, you said medications. are often the first line of, those are the first line of defense. And then anti-arrhythmia drugs, they can help regulate heart rhythm, while other medications, such as, I think a lot of us have heard of the term beta blockers. Yeah, those, or calcium channel blockers.
Right.
They manage associated symptoms such as a high heart rate. And then blood thinners may also be prescribed to prevent stroke in cases of atrial fibrillation or other arrhythmias linked to blood clots. And if medications do not do the job, or if side effects of the medications overweigh the benefits that they are providing you, there are other things that can help, such as specific procedures. One option would be artificial implanted devices, and these are usually used in more severe arrhythmias, and the surgical implantation of devices like a pacemaker or implantable cardioverter defibrillators. These devices help maintain a consistent heartbeat by sending electrical impulses to prompt the heart to beat at a normal rhythm, and or they monitor heart rhythms and deliver electrical shocks when life-threatening arrhythmias such as ventricular fibrillation are detected.
Right. Another option for a treatment could be a catheter-based procedure.
So when they're inserting a catheter in your arteries and working them through your system up to your heart.
Right. And that would be an ablation therapy.
Okay.
That involves, like Jean said, threading the catheter to the heart to target and destroy small areas of heart tissue that are causing abnormal electrical signals. And I'm going to have this one done after the first of the year.
There is also electrical cardioversion, and this is uses controlled electrical shocks to restore a normal heartbeat. I think we mentioned that earlier. And often it's used in cases of atrial fibrillation.
Lastly, there's surgery.
Okay.
In rarer or complex cases, more invasive surgeries, such as a maze procedure, and I didn't look that up, so we'll have to follow up with that on the website, may be performed to create scar tissue in the heart that redirects electrical signals and corrects irregular rhythms.
Okay.
In addition to medical treatments, adopting a heart-healthy habit can play a significant role in managing arrhythmia and preventing its progression.
What are some heart-healthy habits?
Dietary changes,
Okay.
emphasizing a diet rich in fruits, vegetables, whole grains, lean protein, low sodium, and unhealthy
Cutting out.
and cutting out unhealthy fats.
Okay.
I almost said I was going to take them to help control conditions like high blood pressure and cholesterol.
Okay.
Also, regular exercise. Engaging in moderate physical activity to improve heart health should should be tailored to the individual's condition and monitored if needed.
So like a hospital-based medical center that has a heart fitness.
Yeah, and then all you
program
have
or
to do
something?
after you sign up is go.
Yeah, that's step 2. Okay.
Stress management.
Okay.
High stress levels and poor coping mechanisms can trigger or worsen arrhythmias.
Mm-hmm.
Techniques like mindfulness, yoga, or counseling can help manage stress effectively.
How's that going?
Well, I found a class at COD that I circled here for beginning Tai Chi.
Okay.
And that starts on January 27th and it goes through May 12th. So I think I'm going to sign up for that.
Okay.
And lastly, avoid triggers.
Mm-hmm.
There are several triggers that can initiate arrhythmias.
Okay.
Caffeine is one,
Mm-hmm.
alcohol is another,
Mm-hmm.
tobacco use. Those can all exacerbate arrhythmia symptoms. And the only one I had to give up was the caffeine because I don't drink or use tobacco.
Okay. Well, I think that gives us a good overview of this topic. So to recap, arrhythmia or irregular heartbeat can be managed and treated through a combination of medical interventions and lifestyle adjustments for the most part. And they need to be tailored to the specific type and severity of your condition. Addressing underlying conditions that contribute to arrhythmias is crucial. So, like proper management of high blood pressure, diabetes, obesity, and other cardiovascular diseases reduces the strain on the heart and helps maintain a stable rhythm. A comprehensive approach combining medical treatments and lifestyle changes alongside regular monitoring and communication with your healthcare providers offers the best chance for you to effectively manage arrhythmias and improve overall quality of life. And you've been using a tiny little portable EKG machine
The cardia.
that sends a signal to your phone, and then that transmits it to your healthcare providers, and they monitor it on a regular basis.
Right.
And so
And they call me when they see something goofy and
Yeah,
say, "How are you?
yeah, what's going on?
Are you losing at cards again?" No, I'm just kidding. Well, thank you very much for taking the time to join us today. If you have any questions or comments related to today's show, you can contact us at PodcastDX@yahoo.com. We have a website, PodcastDX.com. We're also located on Facebook, X or Twitter, TikTok, Pinterest, and Instagram.
And if you have a moment to spare, give us a review wherever you get your podcasts. And as always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition and or treatment, and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you've heard in this podcast.
Till next week, happy holidays.